I agree to having this health assessment performed and videotaped.
Okay, so I'm checking the patient's charts. It looks like there is a head to toe assessment being ordered by the doctor. There's no discrepancies in this patient's chart, and I have all of my needed equipment right here. So I'm going to close for HIPAA. I'm going to wash my hands. I'm washing my hands, and I'm foaming. Great. I'm walking into the patient's room. Knock, knock. Closing for privacy. I'm going to foam again. Hi, my name is Emily. I'm going to be your student nurse today. Would you mind stating your full name and date of birth for me, please?
Grant Dunn, 0509-1999.
Great, and that matches up with my charts. And the MRN matches with my charts. Do you have any known allergies to anything in the environment, any food, any medications?
No.
Okay, and that also matches with my chart. Great. On a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain you've ever felt, how would you rate your pain?
0.
Okay, great. And I know I've already asked you this, but can you state your name for me again?
Grant Dunn.
So patient is oriented to self. Do you know where we are today?
Hospital room.
Patient is oriented to place. And can you state the month and the year for me, please?
December 2021.
Okay, so patient is oriented to time. So patient is alert and oriented times 4. Okay, I'm going to be performing a head to toe assessment on you today. Is that all right if I proceed?
Yes.
And you feel comfortable?
Yes.
Okay, awesome. So I'm going to start by inspecting the patient's skull. The skull is normocephalic. The hair is evenly distributed over the entirety of the scalp. There is no noticeable masses, lesions, alopecia, or areas of baldness, and there is the hair is brown in color and is thick in texture. Moving on to the facial features are symmetric with one another. There's no swelling or edema on the face. And moving on to the eyes are evenly distributed. The hair is evenly distributed over the eyebrows, and they are symmetric with the facial features. And there's no spontaneous movements. Moving on to the eyes are the irises are blue, the sclera is white, there's no spontaneous movements, there's no ptosis, there is no eye bulging. And now looking at the corneas are clear and shiny and round on both sides. And now I'm just going to measure the patient's pupils. So the pupils are evenly round on both sides and they're 5 millimeters each. Now I'm going to just have you look straight for me. I'm going to do a light reaction test. The pupils constricted and dilated evenly on that side. Now try on this side. The pupils evenly constricted and dilated on both sides as well. So now I'm going to move on to the ears. The ears are symmetrical with the facial features. There is no redness on the ears. The skin tone is even. There is no discharge, drainage, foreign objects or hearing devices in the ear, and there's no masses or lesions on either side. Moving on to the nose is symmetric with the face. The nostrils are both open and symmetric on both sides, and there's no noticeable masses or lesions or drainage or bleeding coming from the nose. So now I'm just going to have you open up your mouth for me, please. So the oral mucosa is pink and moist all over, and there's no noticeable masses or lesions. All teeth are present and white. Can you go ahead and stick your tongue out for me, please? The tongue is midline. There is no white or red coating, which would be indicative of a fungal or bacterial infection, and there's no noticeable masses or lesions on the tongue. The uvula is also midline, and the tonsils are not swollen or enlarged, and there's no white or red coating, which also would be indicative of a fungal or bacterial infection on the tonsils. So now I'm just gonna go ahead and palpate. So I'm gonna start with the scalp. Let me know if there's any tenderness with any of this. Okay, great. There's no masses or lesions on the scalp. Moving on to the ears. There's no tenderness noted. Moving on to the sinuses. No tenderness noted there. Now, can you just go ahead and look up and swallow for me, please? So the trachea is midline. Now I'm going to go ahead and palpate the patient's thyroid. The thyroid should not be palpable. Good. The thyroid is not palpable. So now I'm going to go ahead and palpate his lymph nodes. The lymph nodes should not be palpable. So starting with the pre-auricle, not palpable, posterior auricle, not palpable, occipital, not palpable, anterior cervical, not palpable, posterior cervical, not palpable, submandibular, not palpable, submental, not palpable, and supraclavicular, also not palpable, so that's great. So now I'm going to move on to his skin integrity. So looking all over at the upper extremities, there's no redness, there's no masses, there's no lesions, skin tone is even all over. Moving on to the upper extremities, at the joints, there's no deformities at the joints, there is no swelling, masses, or lesions on the joints, and there is no edema or redness on the joints. Now, his skin is warm all over on his upper extremities, which is great. And now I'm just going to take a look at your fingernails. There's no clubbing on the fingernails, there is no contour, and the fingernails are smooth. And now I'm just going to check your cap refill. Great, cap refill was +2 on the fingernails. And so now I'm going to move down to your lower extremities. So upon inspection, there's no masses, lesions, skin tone is normal all over, there is no redness, the joints are not deformed, there's no swelling on the joints, edema would be 0. Moving on to the toenails, there is no clubbing on the toenails, there is no contour, and the toenails are smooth. So now I'm just going to check cap refill in his toes. Great, so cap refill was +2. So now I'm going to foam, and I'm just going to check the warmness on your lower extremities. Great, so his skin is warm all over on the lower extremities. I'm going to foam again. Great, so now I'm just going to check your musculoskeletal system. So I'm going to have you, I'm looking at the head and the neck. The head and neck are aligned. Looking at the spine is aligned. There is no deformities in the spine. There is no signs of kyphosis, lordosis, or scoliosis, which is great. Thank you. So now I'm just gonna have you go ahead and squeeze my hands for me, please. So the bilateral hand grasp is +5 and equal bilaterally, which is great. Now I'm just going to move on to the lower extremities. So looking at the lower extremities, he can move freely, and there's no spontaneous movements of either the upper or lower extremities. So I'm going to have you place both your feet on my hands, please, and press down. Great, so that is +5 and equal bilaterally, and now go ahead and press up. Great, +5 and equal bilaterally, and he has free movement of all his extremities. Now I'm foaming again. All right, so now I'm just going to check your cranial nerves, all right? So starting with cranial nerve number 7, I'm looking for any facial drooping and asymmetric facial movements. So go ahead and smile for me, frown, show me your teeth, puff out your cheeks, and raise your eyebrows. Awesome, great. And now I'm just going to have you press against my hand. Great. So now I'm going to check cranial nerve number 5. So I'm checking for facial sensation. So I'm going to pick up my cotton ball over here. And now I'm just going to tell me if you can feel this.
Yes. Yes. Yes.
Awesome, great. So now I'm just going to, here I would normally test for corneal reflex by stimulating the corneas, but we're not going to be doing that today. And so now I'm going to check cranial nerve 3, 4, and 6 by checking ocular movements. So go ahead and look straight for me and just follow my pin light. Awesome, so there's no mistiness. So checking cranial nerve number 8, I'm going to evaluate your hearing by performing the whisper test. So I'm going to stand behind you and just repeat whatever you hear me say.
4-2K.
Awesome, so now I'm going to move to the other side.
4-2K.
Awesome. So now I'm going to check cranial nerve number 1 by checking the patency of your nostrils. So the nostrils are open, they are equal on both sides and symmetrical. And so now I'm going to have you close your eyes and I'm going to just tell me what you hear, or smell, I'm sorry.
Alcohol. Alcohol.
Awesome. So that was just an alcohol pad I had you smell. So now I'm going to move on to cranial nerve number 9 and 10. By checking your pharyngeal movements. So can you go ahead and open up and say, stick out your tongue for me, please? I would check for the gag reflex here, but we're not going to be doing that today. So now I'm going to have you stick back out your tongue. I'm going to check cranial nerve number 12. Move your tongue side to side, please. Okay, good. There's no masses or lesions on the tongue. The tongue is able to move side to side, and it is midline when it is resting. So cranial nerve number 11, I'm just going to check your shoulder girdle. So I'm going to have you shrug your shoulders for me, please. Awesome. And move your head side to side. Great. So now I'm going to check cranial nerve number 2. Here I would evaluate your visual field by using the Snellen chart, but we're not going to be doing that today. Okay, so now I'm going to move on to, I'm going to go ahead and check all of your pulses. I'm going to start with your carotid. I'm going to do check one at a time to make sure I don't cut off blood flow to your head. Great, so the carotid pulse was +2 and equal bilaterally. Now I'm just going to check your brachial pulses. +2 and equal bilaterally. Checking your radial pulses. +2 and equal bilaterally, great. Now I'm going to check your popliteal pulses. +2 and equal bilaterally. Checking your posterior tibial pulses. +2 and equal bilaterally, great. So now I'm just going to check your dorsalis pedis pulses. +2 and equal bilaterally, awesome. And I'm going to foam now. So now I'm just going to go ahead and listen to your carotid arteries for any signs of bruit. So I'm going to go ahead and clean off my stethoscope really quick here. Okay. No bruit. No bruit. Okay. And on upon inspection of the precordium, there's no pulsations, there's no thrills, there's no masses, there's no lesions. So now I'm just going to go ahead and take a listen to your heart sounds. Okay, starting with the aortic, it's going to be the second intercostal space down on the patient's right side, and S2 is going to be loudest here. Great. Moving on to the right side, this is going to be the second intercostal space down on the right side. This is going to be the pulmonic, and S2 is loudest here, which is great. And moving down to the third intercostal space is Erb's point, and S1 and S2 are equal here. Great. The tricuspid, which is going to be the fourth intercostal space down, S1 is loudest here. And now moving to the point of maximal impulse, which is going to be fifth intercostal space down and midclavicular line. I'm just going to go ahead and listen to that for a full minute starting now. Good, 85 beats per minute. So now I'm just going to go ahead and palpate your precordium. Let me know if there's any tenderness with this. Good, there was no noted masses or lesions and no pulsations or thrills. So now I'm just going to move on to your lungs. So now I'm going to, I'm looking at the anterior chest wall. There's no heavy labored breathing. There is no pulsations or thrills. There's no masses or lesions like I've already stated. There's no pursed breathing, there's no nasal flaring, and the breathing is quiet. I'm just going to go ahead and one more time palpate. Let me know if there's any tenderness with this. Okay. And if you could go ahead and turn around for me, please. Other way, I'm sorry. I'm just going to check the tactical firmitis. Great. There's no tactical firmitis. So now I'm going to go ahead and check symmetrical chest expansion. So go ahead and take a deep breath in and out for me, please. Awesome. So the chest expansion was symmetrical. So now I'm going to go ahead and percuss your lungs starting at the apex. Okay, so there's resonance found in all areas, no noted dullness. And now I'm just going to go ahead and listen to your lung sounds. I'm going to clean my stethoscope one more time. Great. Okay. So this would be bronchial lung sounds up here. This is vesicular lung sounds down here. Vesicular. 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 Again, vesicular. And on this side as well, vesicular on these last 2 points. Great, there was no adventitious lung sounds noted. So now I'm just going to go ahead and have you lay down for me, please. Okay, and put your knees up. This is to prevent any guarding. So now I'm just going to look at your abdomen. So upon inspection, there is no Austin bags, there is no drain tubes, there is no pulsations or thrills. The contour of the stomach is flat, and there's no striae or masses or lesions or redness noted. And now I'm just going to go ahead and I'm going to percuss in each quadrant. So starting with the right lower quadrant, resonance, 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 and resonance. So there's no noted dullness in any of the quadrants. So now I'm going to go ahead and I'm going to palpate each of the quadrants. I'm going to do light palpation, which is 1 to 3 centimeters deep. Let me know if there's any tenderness with any of this. Great, there was no noted tenderness. Usually I would do deep palpations, which would be about 5 to 8 centimeters deep, but we're not going to be doing that today. And now I'm just going to give a lesson to your bowel sound. So I'm going to clean my stethoscope one more time. Okay, so now I'm going to give it, your bowel sounds a listen. Starting with the right lower quadrant. Good, bowel sounds are noted and normal. Bowel sounds are noted and normal in the right upper quadrant. The left upper quadrant, bowel sounds are noted and normal. In the right or the left lower quadrant, bowel sounds are normal and noted. And there was no hyperactive or hypoactive bowel sounds. And I'm just going to listen to your aortic. And there's no bruit in the aortic, the abdominal aortic. And normally in this position, I would have you lay down on your back, sit up, and lay on your left side to listen for any heart murmurs with the bell of my stethoscope, but I'm not going to be doing that today. And on a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain you've ever felt, how would you rate your pain today?
0.
And do you have any questions for me?
No.
Okay, awesome. We'll have a great rest of your day. Thank you.
Thank you.